It's Kathy Kress again, and I am back with my Geriatric Care Management YouTube series. And this time we're doing tools of the Geriatric Care Management Manager, and it's all based on my new operations manual for a Geriatric Care Management Agency. And so we have been dealing, this is part 2, with Gertrude Sterling. And you are Miss Full Charge, the Geriatric Care Manager, and you are assessing her with a whole family tool, whole family approach. And so, you know, what Miss Full Charge has found is, and you can go back and look at the last series, but just briefly, Jane, the daughter, has the only daughter syndrome. There's 2 other children, adult children, and they are both males. Gertrude Sterling is an 84-year-old woman who the only daughter is about to place in a nursing home. And you are called in, Miss Full Charge, to give your own opinion. So Jane's burnt out. She's totally burnt out. She's an attorney. She has children of her own. They're teenagers. One of them is a girl. You know how it is to have a girl as a teenager. Oh my God. But she is so happy. Jane, the daughter, is so happy because you, Miss Full Charge, are able to see this only daughter syndrome without blaming her mother. And that's a miracle here. That's the tool you're able to do, because you're able to ferret out of Jane exactly how she feels, so that Jane will not be blaming her mother. There won't be this mediation that will go on. And the issue is the mother refuses any care because she sees Jane as the only daughter. And why? Because Gertrude was the only daughter to take care of her own mother, and before that, generations of Danes had always had a designated daughter who did not get married and cared for the mother till the end of her life. And Gertrude's mother was killed by the Nazis. She's traumatized. So you've taken this whole family approach. And what does that mean about a family? A family is like a pond. If you throw one stone in that pond, ripples come out all over the pond. And basically, that's how an older person affects a family. Just think of, you know, the pond is filled with a family, and when the older person, as Gertrude did, breaks their hips 6 years ago, so she has ambulation problems and caregiver issues, and also she's widowed 10 years ago, the ripples go out all over this family. And that basically is the whole family approach, because you have to take in the needs of all of these other children. And who else is involved? Basically, you as Miss GCM, the Full Charge. Miss Full Charge. My dad used to call me that. That's how we got to this. He would be so happy I would be using it. Cat, he'd say. Who else is involved, Miss Full Charge? What other tools are you going to use? Well, you're going to use that whole family approach, but you are going to use the continuum of care, and that's all the resources out there in the community. Assisted living, which almost she's going to. It could be the blind center because she has macular degeneration. It could be physical therapy. It could be private duty home care, which of course Gertrude is rejecting because she believes through generations of her family, her daughter should only care for her. You could use formal systems, and you are part of the formal system because you're a geriatric care manager, but so is the physician, so is her attorney, so would a conservator be, or a guardian, if that came to that. So you have informal care, which is the family, and formal care, which are caregivers and you, Miss Full Charge. So we're going to end here, but this is a hanging cliff. What is going to happen? Jane is going, oh my God, her hair is on fire, as most caregivers are. Gertrude is going, I do not want to go to assisted living, and she is mentally competent. So what would you do, Miss Full Charge? Well, we'll find out what Miss Full Charge in the movie, in the YouTube, does. And you can tune in next time. My website is kathykress.com. You can tune in, you can check into that go to the link and find out all about me, my new manual, all my books, anything personal you want to know about me, and I will see you next time.